Good evening, Dr. Eldridge and fellow peers. My name is Giovanni DiStefano, and I'm here to discuss what it means to be a clinical mental health counselor. Although the profession is often compared to psychology and sociology, there are characteristics which set the field apart from these two sciences. According to Carmichael Netford, the philosophical underpinnings of our counseling is its emphasis on wellness, normal development, empowerment, and prevention. This video will explain what clinical mental health counseling is, why it is important to society, and what is needed to be an effective counselor. Lori Myers, in her article, In Search of Wellness, asked Dr. David Kaplan, the ACA Chief Professional Officer, what makes counseling unique. He indicated that counseling embraces wellness from its beginning. He further explains that the field practices a comprehensive holistic approach, intertwining the element of relationship with concepts of self-worth, spirituality, emotional awareness, coping skills, and problem solving. Personally, counseling is a journey for all parties to partake in the process of self-discovery, to help the individual to understand and accept where he or she is at the moment. This allows proper theories and models of counseling to guide clients towards health and self-realization. You may ask, why is mental health counseling important? Well, my initial response is because society has gone mental. The American Mental Health Counselors Association takes a more scholarly approach. The organization points out that CACREP certified institutes prepare practitioners to meet the national standards in education, training, and clinical practice to administer effective consumer-oriented therapy to the public. Counselors are then able to provide crisis management, psychotherapy, assessments, and other services to institutions and individuals who might not otherwise be able to afford such care. In addition to this, there is the holistic approach to the field. Mental health issues are multifaceted, therefore a holistic approach is a natural course. This permits counselors to work with other medical professionals to administer the best care possible. Cheers. As counselors, we need to understand what makes counseling effective. This issue can be approached in various ways. For me, a romantic at heart, counseling requires empathy. Empathy for people who society has labeled as abnormal. I honestly don't think I have ever met anyone who falls into this abstract idea of the normal, though most of us, at face value, fit this description. Counseling requires listening to the narrative of an individual's discourse. It asks us to connect with the client, even if it goes against our moral and ethical beliefs. The profession calls on us to find a universal theme, the universal theme, the condition of seeing one's humanity. Effective counseling taps into this reservoir. It guides clients towards solutions that help him or her to better understand his or her condition. Counselors provide the methods and models to assist these individuals to cope with their issues. Through this process, the client will understand that healing is possible. Effective counseling requires lifelong learning as well, with a strong foundation in lifespan theories, and to have an open mind that there is value in new schools of thought and in theories which challenge or contradict our theoretical beliefs. Advocating for the client is equally as important as counselors. Ratz and Hutchinson define advocacy counseling as counseling which has become known for emphasizing social action and justice. The first standard of the ACA Code of Ethics, A1A, Client Welfare, instructs counselors to respect the dignity and promote the welfare of clients. When working with vulnerable populations of different cultural backgrounds, practicing proper advocacy using multicultural counseling is essential. The advocacy model created by Lewis Arnold House and Torpik nurtures clients and systems advocacy and leads into social and political advocacy naturally. Advocating for the profession is equally as important. Amy Milson points out that the focus of the American Counseling Association is to advocate for the practice that allows the professionally recognized and qualified to provide mental health services. The ACA also works closely with the regions and various divisions and passions in each field and champions the importance of counseling services to communities. For example, it collaborates with our division, the Clinical Mental Health Counseling Association, and in return, our division aids organizations and individuals to promote personal issues. It coordinates concerns and creates a platform to implement and advocate for local and national, to implicate and advocate at a local and national level. My professional identity of a clinical mental health counselor is also my personal identity. Identifying as a practitioner in this field reveals its importance to society as well. Being mindful that my practice is a career and a way of life, I will demonstrate what is needed to be an effective counselor. Thank you for taking the time to listen to my recording, to my video, and I look forward to your responses. Enjoy your evening.